I want to dive right in with her. Ms. Paxton, welcome aboard.
Thank you very much, Mayor.
Talk to us a little bit today about, the county and the state and your perspective of where we're going in this pandemic.
Thank you very much. Yeah, I think everyone is very well aware that we're in the middle of a pandemic here, and that Fulton County happens to be one of the is reporting the largest number of cases and deaths behind only, I think, Albany at the moment, partly as a function of the fact that we're the largest county in Georgia, and also as part of our demographics. As you're all really well aware now, COVID-19 definitely affects us, and I'm speaking African Americans, and particularly African Americans over a particular age, much harder than other parts of society. And so that's been a huge issue for us. And so what we are doing as a state and as a local public health entity is we are doing all the things that need to be done when you're dealing with an infectious disease, and are concentrating our efforts on testing people to see whether or not they have the infection. For then, once we've identified people who are infected, finding their contacts, because you want to find their contacts and make sure that they self-isolate and that they get tested as well, so that we can control this epidemic. So we have that whole aspect that we're doing that focuses around finding and tracing currently infected people. And then we have the other part of it, which is the prevention aspect, because we all have a part to play in preventing this from going further. And so all the things that we know about wearing masks when you go out, washing your hands, maintaining social distance, 6 feet away, all those sorts of things, we're also concentrating on that right now. We have had the goal of the shelter in place was twofold. Of course, one was to, in general, to reduce transmissions, but also with a specific aim of not overloading of keeping our healthcare system from being overloaded, like we've all seen happened in New York and in other countries where people, the system was overwhelmed and overburdened, and they could not take care of all of these people. And so one of the things about the shelter in place did, in fact, it was successful in keeping us from reaching those high levels of infection that we would have expected if we had not done the shelter in place. But as you all know, now that has been lifted, it's mostly lifted. There are certain people for whom the shelter in place order is still in effect, but people are now getting out and about more. And so we need to really step up our actions, our prevention actions, so we can prevent a resurgence of COVID-19 as people get out and about. And so that's one of the things that we're really working on. We're working on the prevention side, so people to not keep on, so that they don't come off of the prevention things that they were doing. And then we're working diligently on making testing more available and doing contact tracing for people who are infected, so we can find other people that have been infected and hopefully contain this epidemic.
Well, thank you, Doctor. Our city is we were one of the first city to just kind of shut down, people say, in the country, and we're very, very proud of that. But our policy right now, as a city and from the mayor's office, is that we will practice sheltering in place and social distancing. Mm-hmm. We have a few questions I want to get into. I want to get with you on those. One is, Dr. Paxton, and city managers, feel to chime in anytime you'd like.
Yes, sir.
The one question is, when will the county resume operations, and what are the basic details, Dr. Paxton?
Yeah, I'm sorry. I'm just looking for my notes because I had written that down yesterday. I don't know if any of you had listened in. The Board of Commissioners meeting was Wednesday, and this was explicitly brought up then. And from my notes, I have that the plan at the moment is to internally open to bring employees back into the main offices on June 1st, and then to open to the public beginning on June 15th in sort of a graduated system. So I didn't write down everything, but some departments will come online before others. So as I wrote down, I think the tax commissioner's office would, be open to the public somewhere around June 15th. Mm-hmm. And then they will keep, every 2 weeks they'll be adding in more more departments. Like some libraries will open like on July 1st, and the public works would open. And eventually at some point there would be more, more departments all brought online. So if the plan is to do that gradually. I would believe that, because this was brought up at the Board of Commissioners meeting, which is public, that there's probably, you could probably get access to the notes and presentations from that meeting, which would have more details. But those are just the notes that I made for myself about, what was presented about the planned openings.
Okay. Make sure that we utilize your time. We have several other questions, and one is: has the number of cases affected by this? Has the number of cases by the state affected the state? I'm sorry. Has the number of cases affected by the state's lifting of the restriction?
We've been seeing at the time that the shelter in place, was put in place statewide, there was kind of a plateauing of cases at that time. Since then, we have seen a kind of a mild drop off in reported cases, in reported deaths, in hospitalizations and ventilator use. So that has been falling, gradually. But what we do know, though, is there's always a lag in terms of biologically. There's a lag from the time that somebody might be exposed and infected to the time when they develop symptoms and start getting really ill. So that can vary anywhere from like 3 to 14 days. And then there's also a reporting lag. A person can come in and get a test, but it would take anywhere from 2 to 4 days, or maybe even a little bit longer for us in the public health sector to get that information and get that into the database so that it can go into these charts. So basically what we are seeing is we have seen a decrease in cases, and we're hoping they'll be real, but it doesn't yet fully reflect what we might expect to see now that the shelter in place has been lifted, because that was lifted, 2 weeks ago or something. Mm-hmm. And we're only now starting to see that people are becoming more mobile. We can track that. I guess they use cell phone data, so it's anonymous, but they can see where cell phones are moving. And so in comparison to when the shelter in place started, at the peak of the shelter in place, mobility was only about 30% of what it had been before shelter in place started. Now that shelter in place has been mostly lifted, it's come up a little bit more so in that, but it's still only about half, 50% of what it was before shelter in place. So people are limiting their movements, which is good. But I kind of expect that, people being human, as people going back to work, they're going to start moving around more, and we're probably going to get more mobility. And so one might expect more infections at that time if people are not, doing all the prevention things we know they need to do. So I'm just saying it's early days. That was a long-winded explanation to say it's early days to see what the effect of removing the shelter in place will be on infections.
Okay, I want to segue right into the next question because I think it's pertinent, and it is: what is the difference between COVID-19 testing and antibody testing?
Oh, okay. There are two types of tests, and this comes up actually quite a lot. The tests that you'll see at all of our testing centers, with the nasal swabs, what that is a PCR test, a polymerase chain reaction test. It is actually looking for pieces of the virus. Okay, so when we do those tests, it's a test for viral particles. Okay, and so that tells us that person has an active infection. Now with the antibody test, which is done as a blood test, not a nasal swab, but as a blood test, what that does is that shows evidence of that a person has been infected at some time in the past, but we don't know when that was, and we don't know. And you can have been infected in the past. Might have been asymptomatic. You might have been symptomatic. You might have gotten over it. You are no longer infectious. Okay, but your antibody test is still positive. So it does not tell you if you are currently infected and infectious. So we do not use the antibody test to tell somebody that you have the COVID-19 disease, because it does not tell us that. The other thing it does not tell, which is, I'm anticipating the second part of this question, which always comes up, is then people ask, well, if I have positive antibodies, does that mean that I am immune and I cannot get COVID disease again? And the thing is, we simply do not have enough data to say that. There is some evidence from other places in China and other countries that have gone through this before we did, that gives some indication that maybe having antibodies does not confer immunity, that there's some evidence that that some of these people may be getting infected again. And so the fact that you have antibodies does not mean that you are immune. It means simply that you were exposed to this infection in the past. And the other thing that I was going to say about that is, then you might ask them, well, why do we do these antibody tests? These antibody tests are extremely important for us from the epidemiology side. And in fact, we here in Fulton County, we worked with CDC to do just that sort of testing. Well, the CDC did it and we gave our blessing to it, to do just that sort of testing among our community, the African American community here, to see what are the actual levels of people that have been infected. And so, to use that to sort of track how was this infection, sort of traveling throughout our community. And that helps me as the public health person to figure out how are we going to strategize to prevent this from happening, continuing to occur in our community and in other places. So that antibody testing is a fabulous tool for that on the population level, but for an individual person, it's not of much use at this time, because we simply do not have enough information to know what does a positive antibody test mean for a particular person.
So, we have a lot of testing sites here in our city, but they do the nasal testing.
Yes.
How does one get to the antibody test?
By participating in one of the studies that goes. That's the best.
That doesn't mean guinea pig, does it?
That's the best way to do it. Well, I've heard, that there are other, I don't control what every person or every group decides to do in the state, and so I have heard that there are some like private corporations and maybe even some cities that have contracted with private antibody testing firms to do this sort of testing. But I'm very outspoken about that. And I said, if you're trying to use this as what I've heard it referred to as an immunity passport, to say that, if somebody has these antibodies, it's safe for them to go back to work because they're not going to get, infected, or whatever they're thinking, I say, you're not thinking correctly. That is an inappropriate use of these antibody tests. So there are ways to get the antibody test, but I'm saying if someone is going out to do this because they think it's somehow going to have an effect on their own personal health or tell them anything about their likelihood of getting COVID or of transmitting COVID, the science doesn't back that yet. So I would say, don't waste your money, But if somebody comes to your door and says, we are conducting a sanctioned study by the CDC or Emory or there's some other Georgia state, then definitely I would urge you to cooperate with that, because that on the larger scale gives us really valuable information about how we can combat this virus in our communities.
Well, Doc, so many people are looking at the data, no matter where they get it from. And one of the questions has been posed that the data gets confusing as it comes from the state health department. Can you expound on that a little bit as to why that is?
Well, I don't, I don't actually work in the department at the state department that does this information. What I did hear from them though is that for a while there was the people who were compiling the data were not actually epidemiologists. They were data analysts that were, that had no public health background, okay? Mm-hmm. So they were putting together these charts and putting them on the website, but without having the epidemiologists look over it or approve it before it went out. And that led to a big problem when they were constructing graphs that made no public health sense. And it did, create a big problem. You might have read about it in the AJC, and actually got to the Washington Post. I mean, it got all over the country. That's been corrected since then. And so the data that's now going up on the website has been vetted. There are still things, people being human, there are a couple of things that happened. For a while there, they were including antibody testing that had been done in the case counts until someone realized that had happened and they pulled them out, because as I just mentioned, we do not use antibody testing to determine whether or not someone is an actual case, actually has the disease. So that was quickly corrected, and that no longer is in the database because it's not relevant. So now, pretty much what's on the database is pretty consistent. And they try to update, and they do update it every day so that people can see what is going on a day-to-day basis, as we do on our Fulton County website. We have the daily numbers that come out.
Yeah, I had a constituent call me the other day, several matter of fact, Doc, and they were concerned about when they take the test, the response back from the results have gone longer. They're saying instead of days now, we're talking weeks. Can you talk to me about that a little bit?
Well, yeah, but the thing is, it's been very rare that it's been weeks. What happened is that as tests wrapped up, a lot of our tests were and continue to be done by private labs, okay? And I think some of these private labs really just didn't have they didn't realize how slammed they were going to get with the sheer numbers of tests. So for a while there, we had a couple of labs who had originally been able to do a 1 to 2 day turnaround, and they got overwhelmed, and it got unacceptably long. We were having long things like 6 days, 7 days, 8 days, which we found to be unacceptable. So what's been done since then is that there's been an investment made in a couple of things. One is beefing up the Georgia Public Health Lab so that we can have a little bit less of a reliance on these private labs. So that's happening, and so their output is increasing a lot. The other thing is that we moved around where the labs were being sent to. So to take the pressure off some of these labs that were not able to, that have this huge backlog and couldn't get through it. So we removed those around to different labs, and that has fallen. So now, that's helped. And so now our average return time is now along the lines of between 2 to 4 days. That we get for us to get the labs back. And then also there was a mix-up at one point. You might have read about this in AJC at one of the National Guard sites. Because there was this backlog, they were moving the samples over to another lab. I guess that Augusta University was affiliated with, and tests were lost. So people had to come back in to get retested. They weren't happy about it. We weren't happy about it. Nobody was happy about it, but it happened. So those people had to be retested because the labs were there. Something had gone wrong with that. So there were the kinks that we that happened, and so as they come up, we've been improving our processes as each of these things comes up. So we are seeing less and less of these problems because now we've learned how to deal with them.
Mm-hmm. So, everybody wants to know, and I guess your opinion on it. Why are there so many cases in Fulton County?
Well, you have to look. Well, we're getting more and more information about that. For one thing, there's something about this virus that seems to affect a certain demographic harder. It affects people who have coexisting conditions like diabetes or hypertension. And our community, African Americans, we have higher rates of that than other demographics. And so that is probably one thing. The other thing is in terms of how the virus is transmitted. It's transmitted by being in close contact. And if you have a job that requires you to be facing with the public, like if you're I don't know, I'm just pulling this out of my hand, but if you're like a grocery store clerk and you're seeing hundreds of people every day, your exposure is going to be higher than the person who is working at home, doing something, maybe a more white collar job that requires they don't ever have to leave their house because they're doing everything, So I think that what it is it's probably a combination of things. It's probably a combination of biological factors like coexisting things like diabetes, smoking, hypertension, all that, all of which affects our community more than it does other communities. And then probably another thing of environmental factors of how people have those people who have to be out and about, being more exposed to other people, and so coming in contact with the virus more than other groups. So, that's what I think is going on here.
Well, I was in a conversation, Dr. Paxton, about several days ago about some of our subdivisions that leadership was talking to me, and they want to know, and what's your opinion of opening up the swimming pools? That's been a conversation they've been having for a while.
Mm-hmm. Yeah, the swimming pools. I mean, like there was a while there that I was getting emails every single day, I thought, from every single person who had a swimming pool asking, when are you going to come inspect it? When is it going to happen? Well, okay, let me tell you, I have my druthers as a public health person, and I do not control this. I think it's very hard to maintain social distancing at a swimming pool, but, I guess it can be done. The thing about it is that it has been decided that the pools are open, okay? And the Memorial Day weekend is coming up. People want to get out. They want to use them. So we are responding to that. And so we have all of our pool inspectors are out doing that right now in the hopes of getting them all inspected, before the Memorial Day weekend. I think they're doing they're up to their ears in work at the moment, but I think they'll get it all done. What they're going to need is the help of the public and the pool owners with this to maintain, the appropriate distancing, so that these don't become hotbeds of COVID transmission. That's what keeps me up at night, is the thought of, people getting together, getting too close. You don't wear a mask in a pool, so I know they're not going to be wearing masks, so. But so it's on us. It's on everyone. When I say us, now I'm talking about us as the community, to do your best to maintain these prevention things, because the pools are open. So you're going to have to, exercise your best judgment, and so that you do not help spread this disease around.
Do you expect the resurgence in the virus in the fall? Or
I do. Again, this is new for everyone. But number one, in the fall is when we always have seasonal flu, comes back. So we're going to have to deal with seasonal flu as well. part of the thing about that in the fall, what happens is that temperatures go down, people spend more time indoors. There are somebody's making you spend more time indoors, and there's more exposures going on. We know that from years of experience with seasonal flu. There's in my mind, there's no reason not to expect that would happen with COVID as well. So we here at the health department are developing contingency plans under the assumption that yes, there will be a resurgence in the fall. If there isn't, we will all be happy, and,
Absolutely.
and celebrate. But you always have to hope for the best, but plan for the worst.
I think you kind of hit on this, but I need to make sure that people understand. It was a question, and that is, those who are infected, can they be reinfected?
We don't know for sure. There have been reports of that, of people who have definitely had documented illness, got better, and then became ill again. In some cases, it's probably because they never completely cleared the infection, and they have what we refer to as a recrudescence. It means like the infection that's there comes, back up. But we can't say for sure that some people might not have been infected, ill, cleared their infection, and then got reinfected. So that's a huge avenue right now of research. And that, again, goes back to what I was telling people about. You can't, at this point, say that an antibody test means that you're immune to further infection, because we don't know that for sure yet.
Mm-hmm. Another question along those lines has been, explain this whole concept of contact tracing.
Okay.
That's been used a lot, and we want people to understand what that means.
Yes. Contact tracing is one of the most important tools we have to stop any infectious disease, but particularly a disease like this, which is so very transmissible from person to person. So what contact tracing is, and I'll just explain first the terminology. The two important words here are case, and the other one is contact. The case is the person that's infected, okay? The contact is not necessarily infected, but it's somebody who has, in some point during the period of infectiousness of the case, has been exposed to that person, and so therefore might have become infected. So the way that we work to stop the spread of this infection is, once a case has been identified, in this case by, with a positive COVID test, we interview that person and say, who were all the people that you were around during this particular period, which you were probably infectious, okay? So we investigate every single person that has a positive test, okay? We ask them about their contacts. Then what this public health system does is we then have to go out and contact and get in touch with those people who are the contacts, okay? And we inform them, you have been exposed to COVID. You have been around a person who has COVID. We do not, for privacy reasons, we do not come and say, you were around Jane Smith who had COVID, or you were around John Doe. We don't do that. We simply tell them, we know that you were around a person who has COVID disease. Therefore, you have to do the following. We ask them if they have any symptoms of their own, so that make sure that they get tested. But we ask that people, and this is actually, we ask, but it's a regulation, it's a law, that they have to self-isolate for 14 days. And that is to prevent, them in, spreading this infection to other people. And so what is going on right now is, as you can imagine, that is a highly intensive process. It requires lots of contact tracers to go out and find all of these people. So what the state has come up with is a web-based application to help with all that. And the way that works is that, okay, when the case is identified, they are investigated by a person, okay, and they get this information, and this case investigator takes all that information and puts it into this web-based application, which is and what that application does is that it automatically sends a text message to the contacts that have been identified, okay? And so the contact will get a text message saying, directing them to go to this website. They go on the website and they're given information. You have been exposed to COVID-19. You need to self-isolate. They ask about, do you have any of these symptoms? And then they give permission to be contacted by text message every day for the next 14 days, for the period of time that they're under observation. And the beauty of this is that, and every single day they get another text message that again asks them, do you have symptoms? And then, of course, if they develop symptoms, then of course they get expedited testing and the like. And so this app helps monitor that. And so the great thing about this is it really it's improved our contact tracing a lot. It's been piloted in several districts. It's now been rolled out here in Fulton County, so we're using it. And it has roughly tripled our ability to get in touch with people more easily. Because if people don't use the app, we hope that they will, because it makes their lives easier. They don't have to deal with us calling them or knocking on their door. We hope that they'll use this app, because if they don't use their app, this is a notifiable, reportable disease. So we still have to contact these people by another route, by calling them or even sometimes going to people's homes to do this. And so we're encouraging people to use the app. So if you get this text message from the Department of Public Health, please open it. And, and then we encourage you to go into and to use this web-based application to do that. We fully recognize that there are some people who don't have access to the internet, who don't have smartphones, can't do that. So we still have a lot of contact tracers who are out there just who are doing this sort of thing. But for people who can use the app, we encourage them to use it. And if they can't use it, then that's fine. We will work around this with humans, contacting you every day.
Yeah. So everyone is waiting for the wonder drug, called a vaccine.
Yeah.
And the president said we'll have one by the end of the year. Other scientists don't agree with that. Give us your opinion about, when possibly could there be a vaccine? Well,
we do know that people, there are so many laboratories around the world that are working on this. So, I actually do not know, when how close any particular laboratory is to finding, to developing this vaccine. Because I'm not a basic scientist and I'm not working on vaccine development. What I do know, though, from my prior life as a CDC epidemiologist that worked on trials on pre-exposure prophylaxis, HIV prevention trials, is what I do know is that I know the system for for testing something after it's come out of the lab. Okay, and so it's important for people to understand that we don't just develop something in the lab and then the next day just start administering it to people. You don't do that. Yeah. The normal process for these things is that something's developed in the lab, it gets tested first in animals, whether that be mice or rats or whatever. It then often goes up into monkey studies, because monkeys we're a lot closer to monkeys than people would like to admit. So it goes into primates, and then after that, if it's safe and it hasn't, it's been proven safe in these animal models, then it goes into humans. And we first start off with small safety studies, because the last thing you want to do is start widely putting something out there only to find out that it's not safe. So we do what we call phase 1 safety studies, which are usually among small groups of people, like maybe 50 people or 100 people or something like that. You test it just to make sure that doesn't show any signs of like killing people or making their skin turn purple or, all sorts of things like that. Then it goes into what's called phase 2 safety studies, which are still safety studies, but they're for larger groups of people and all that. And then after it's passed through these preliminary phase 1 and phase 2 safety studies, then it goes into what we call phase 3, which are the efficacy studies. And that's when you actually take them out into a large groups of people to see, does it work? Does it, in this case, does it prevent people from getting COVID infection? Now, in the usual timeline for vaccine development, this usually takes years to do that. But everyone knows this is a public health emergency, so it is going at lightning speed, all right? But you can't shortchange that. And I mean, you can maybe shorten some aspects of it, but you can't skip them. You cannot skip doing these preliminary safety studies. You just can't do that. And then you have to do an actual study to see whether these things work, okay? So I think that our president's supposed guarantee that there will be a vaccine that's ready to go into humans by the end of this year is wishful thinking. I'm much more along the Dr. Fauci line, and Dr. Fauci is a great scientist, and no one knows more than he does about vaccine development. And he was already trying to manage expectations, like even like going at this vastly accelerated speed that we're at. Probably the earliest would be sometime in the middle of next year that we could actually get a vaccine, and that's assuming that the vaccines that they're working on in the laboratory now work. I mean, some of them might not, and if they don't work, then you have to try another candidate. So I think I'm trying to just manage everyone's expectations. That I think it's unlikely that we will have a mass-produced vaccine ready to go into humans by the end of this year, because that would be working much faster than any vaccine trial I've ever seen in the past.
Okay. Well, Dr. Paxton, we really appreciate you. And I told you I wouldn't hold you long, but if you can stay, we're going to be talking about some of the things that you discussed today and how they're affecting our city. You're more than welcome to put your input in, but we do know that you are time restricted today.
Okay.
All right.
Yes, I'm certainly free, and for another. I'm actually, my next thing isn't until noon, so
okay.
I still have another 20 minutes here.
Well, let's bring in the city manager, Mr. Odie Donald.
Yes, sir. I am here.
Okay, Odie. Based on the conversation we've had with Dr. Paxton and the questions that have come in for her, how do you feel in terms of opening business for the public for our city?
I think we've been kind of in alignment with the doctor. We are definitely not rushing to reopen City Hall and other city annexes, but I do believe that a reopening plan and putting those parameters in place is something that we have to do immediately. And so, as you're aware, on our May 26th meeting, it is my intent to bring forward a draft plan for the review and edification of the council, which will include everything from health considerations, guidelines for businesses and citizens, as well as how we plan to phase operations in at City Hall when the data appropriately guides us in doing so. So I think we would likely take a phased approach, which would not begin until at least mid-June, based on the most recent numbers presented to us by Fulton County and the state of Georgia.
Okay, listen, and Dr. Paxton, I want you to, if you want to make comment on this next question I'm about to ask Mr. Donald, please do so. And that is, what has the city learned from this pandemic?
You know, I'll tell you, I think externally outside of the mayor and council and some of our administration, we've gotten a lot of questions in our first 3 years on why we didn't accelerate certain things. There are certain areas we move very quickly on, and others we kind of take our time to invest in everything from planning and strategic alignment before we actually implement certain things. I think the reason for that is because you don't know what you don't know. And I think we've learned that leveraging best practices, focusing on having a rainy day fund and being fiscally responsible, even though you don't see what may be on the horizon, is the right way to operate, especially for a city like ours. There's no way you could have predicted, well, some people say you could have predicted a pandemic, but there's not really a way to prepare for it. And our budget is being hit just as hard as other municipalities, but we're now able to kind of continue our operations with minimal interruption. And so I think, moving towards the cloud, leveraging technology, being frugal with your funding, delivering high level of services efficiently. The one thing we've learned is that the right way is simply the right way. And so there's no substitute for building the foundation. And so since our mayor and council have given the guidance for us to be able to do that, I think we're in a strong position to recover and maintain our situation in the interim. So we've not learned anything, is that best practices work, and being prepared for a rainy day is a very important part of local government.
Well, and Dr. Paxton, you can chime in on this too. I talked about earlier about we've been one of the first cities to induce a curfew. Mm-hmm. And of course, the governor came back and with his wisdom, and I have respect for him and his job, came back and kind of knocked that out. But we have maintained the policy of sheltering in place and social distancing. And that's kind of been from the mayor's office. That's kind of been where we are. Do you think that's a great position to take? And I don't know how long we're going to be able to take it, but I probably through the whole pandemic. So mm-hmm. Both of you, talk a little bit about that, if that's the right avenue to go down.
Well, I mean, personally, it's the avenue that I'm taking. I limit my my going out. I mean, I have to come in every day to go to work because I leave the health department. But for example, my brother lives with me, and he has some certain health conditions, and so I said, stay home. Don't be out and about. You don't, unless you need to do these things. And so I think that's only wise. I make my 17-year-old daughter I make her wear a mask when she's out. I wear a mask. I don't stand right next to people. I think that it's only wise to do those sorts of things because COVID's out there. We know it's out there. We don't have a vaccine, so we should absolutely not be letting up on these measures.
And Mr. Downell, as a administrator, what's our stance?
Yeah, I mean, I think, you have to look at it from a balanced approach. I think we're responsible for over 100,000 people. And so we have to be good stewards of not only their resources, but their health. And so I think we have taken the correct position for us as a government. But I also believe that, in the day-to-day practical lives of our residents, I'm very cautious about giving them strict orders on how they operate in their households. Some folks simply can't afford to shelter in place, and there's no shame in having to go out into the world and work or do whatever is necessary for you and your family. But for those, who have to operate or who have the ability to telework or stay home or limit your interactions, I think it's the right thing to do for their families as well as the rest of the community. And so, I mean, you see, I'm home today, because I'm in a position to be able to telework and coordinate. But for those who are not, there's definitely no shame in that, but we all have to do it responsibly. And so I think that's evidenced by your food drive that allows people to safely pick up resources and food that they need. I think, for what we've done for our first responders and others, I think it's a holistic approach. So from the government standpoint, yes, shelter in place. From a family standpoint, individual, thoughtful actions on how you coordinate your lifestyle.
Absolutely. One of the questions I get all the time, everybody's suffering from cabin fever now, Doc, and they want to know, man, I need to go to the park. When are my parks going to open? And I'd like to talk to both of you about that, and Doc, from a safety health perspective, and of course, Mr. Donald, you as constituents, I'm sure have called you also.
Yes, sir.
So I want to walk in the park, Doc. What should I do?
Well, as far as I know, there are many parks never closed. They have been open this whole time. Yes, actually, people are encouraged to get out and to exercise and to walk or run. And you can do that if you, but the thing is, maintain your social distance. In my neighborhood, I live in a walking, running neighborhood, and I've seen it. People are just, they're doing these things, but they're maintaining appropriate distance. And that's fine. Absolutely, you can do that. Just don't congregate or stop and, be 18 inches from your neighbor and coughing in their face. I mean, don't do that. Maintain your social distance, and you can get out and about, enjoy the great weather.
Okay, and Mr. Donald, to go a little further with that question, we're talking about the sports leagues and the dance classes. Where are we on that?
Yeah, so I think, again, a phased approach. Early on, we just didn't have the resources to respond to the coronavirus as holistically as we like. And so we're one of the cities that restricted access to our parks and walking trails and other activities like that. I think we've now put the parameters in place where, as a part of our reopening plan, the first thing that would open would be common areas related to parks, to our parks land, which would include trails and things of that nature that people need to really exercise in these communities. Secondly, or a little further down the line, is where sports and things of that nature come in. Is, despite what's happening in these professional sports leagues, it is very difficult to social distance in most of the sports that we offer, which are contact sports. If you have a contact sport, you cannot social distance. It doesn't even make sense to work together. And we don't have the ability to do, like, let's say, the NBA, to pick everyone up, ensure they're safe and healthy, and then quarantine them somewhere else. And so for us, contact sports would be one of the last things that come on. Now, there are some nuances. We're working with the Georgia High School Association, who kind of makes the rules for certain sports. And so our sports leagues align with them. And so we're looking at those things as an opportunity. But I would say, in short, access to trails and general areas and parks would be one of the first things in the reopening plan. Actual access to sporting activities, contact sports, and interactions are kind of handled on a one-off basis over time.
Yes, and we've also done something I think is unique. We've heard the term, Dr. Paxton, hazard pay for our people who are out there, the police and fire who are out there every day doing the service of the people. I think that with the help of Mr. Donald, that we've come to what I think is a unique benefit, because once you look at hazard pay, you have to look at your budget, and you have to see, do I have the dollars to do this? And so, Mr. Donald, explain to Dr. Paxton how we got there, what was our intent, and how the program works.
Yeah, so I think the first thing is one, we wanted to look at a way, just like all cities, the one staff that are never off work, or they never get a break regardless of what is going on in the world, is public safety. And so along with public safety, there are other areas that you don't think about. You don't think about your courts. You usually only think about police, but you don't think about fire, emergency medical services, code enforcement, and other parts of that public safety cluster. And so that's what keeps the lights on for the most part for cities and local municipalities. And so we wanted to make sure that in these uncertain times, we added a bit of certainty and comfort to them. And so instead of hazard pay, we've kind of called it a Gladiator Benefit, because the city is in a much different position than others. If you look at the city of Atlanta, they've been around 100 years. So they've not only grown, but their budget is at a different place than us. Their responsibilities, all of those things are different. So the $25 to $50 million deficit that they're facing with $1 billion budget is very different than the $25 million budget. I mean, the $25 million deficit we're facing with a $109 million budget. You know, that's almost catastrophic to us. And so our council has made a commitment to avoid furloughs and layoffs. And so the only way we're able to do that is to create a deferred compensation type benefit for our first responders. And so Dr. Paxton, I'm sure you're very familiar with the stock market and our money market accounts and things like that. So the concept is you get a baseline benefit, but like the stock market or any other investment tool, the goal is to grow it over time. And so just a quick example, everyone gets their hourly wage in benefit. I think it's up to 8 hours a month or one shift per month. And it's the regular value that it would be based on your hourly salary. But the longer the pandemic goes on and the longer you stay after the pandemic, it grows. So if you make, let's just say for easy math, all of our folks make at least $15 an hour, but let's just say you work an 8-hour shift every day. And so one shift would be $80. Well, the current value is $80. But if you stay with us for a quarter after the pandemic, then that becomes a quarter vested. Or I'm sorry, you stay with us a quarter after you receive the benefit, it becomes a quarter invested. Once you get to a year, it's fully vested, but it's vested at about double its original value for every shift that you work in full. And so initially it's $80, and if you left the city a month from now, well, you are worked and earned your pay. But if you stay with the city for a year after, where we have the time to recover financially, then you basically receive double or triple in some cases that value, which you can use in either time or at such time you separate from the city, you would be paid out in cash. And so it allows us to give one of the strongest benefits that's offered in our region, but at the lowest initial cost possible to the city, who has, you know, like all cities, a cash flow issue at this time, or uncertain cash flow projections at this time.
And I wanted to put that in, Dr. Paxton, but I want to ask you, listening to the city manager and this whole issue about first responders, how has the health department assisted local governments and others in terms of their first responders?
Are you talking about from the financial standpoint?
Well, that don't mean, I'm talking about any way I can get some money, but some services also, Dr. Paxton.
Well, at the moment, I would actually direct you to the Fulton County management. They're like all the CARES funding, I think roughly $104 million that was made available through the CARES Act, which is specifically, you know, to respond to COVID-19. That doesn't come to the health department. That went to the Fulton County. And so they are actually, you know, controlling that. So I don't actually, you know, so that's who I would direct you to talk to about, you know, in terms of funds and all that, because it didn't come to us. So it's not like I don't have a wallet I can open. And
no. But I'm glad you said that, because, you know, some people get confused about the obligations of certain governments. And we're in conversation with Fulton County now as it pertains to CARES funding, because we have some very, very questions about, you know, what can be done with the money, and is it sent to Fulton County based on population, and once it gets there, do they have total control? So that's another issue. But I'm glad to know that. I'm glad to know that
for the edification of our public, and, you know, Fulton County is tuning in, others are watching. You know, they received about $104 million, and I think, you know, the county has been a solid steward and a good partner for a very long time. I recently saw that Commissioner Hausman has a bill coming before the commission that would, any funds that are not expended by November 1st would be distributed to the cities based on a formula. And I think the concept of that bill is appropriate, but I would tell you, got big concerns about waiting until November 1st to distribute money to cities. I don't think a dime would be left to distribute. And so on record, we should ensure that all of the Fulton County mayors request that that bill be amended to remove that November 1st deadline out of the bill and begin a formula to distribute to cities who are on the front line serving our residents right now. I don't think it's time to wait. We love to have access to those funds. I think our projection in COVID response is about $2 million, including overtime for our first responders, additional masks, gloves, and things that allow us to operate and serve our residents safely. And so, while the county does have to utilize some of that funding, local municipalities are really hurting at a time where our budgets are being cut almost in half, if not greater. And so having that type of supplemental income provided from the feds through Fulton County would be helpful to us.
Let's talk a little bit, Mr. Donald, about our program to reopen, and Dr. Paxton, you can jump in on this at any time. Where are we in our formalization of a plan to reopen?
So I won't have a holiday weekend this weekend, but it will be prepared and presented to the council on Tuesday. I plan to distribute it right before midnight on Monday, Memorial Day, to the council, and then also have it posted online in draft form for the public to review. And the city manager's report on Tuesday will explicitly cover our reopening plans, as well as start the discussions about the mid-year budget modification, which I think we've talked that it probably is not the appropriate time on Monday. We'll probably need to call a special call meeting either later in the week or the following week, because while we have budget parameters, we have to get it right, and we are intent on avoiding any furloughs or layoffs. And so we've got to make our cuts very, very thoughtfully. And so those two kind of go hand in hand. So I think Tuesday is the big day to start the discussions and present a detailed and formal plan based on data, information, all of the health considerations, but also those practical things that we discussed earlier, taking into account the different lives of our citizens.
Well, I'm glad you said that, because whatever we do, we have to incorporate much of the conversation that Dr. Paxton had with us today to come up with a formidable plan. Would you agree?
Absolutely. Yes.
Right.
If it's not based on science, data, and facts, then I think we would be leaving our residents hanging at best.
So when are we going to come back to utilizing our meetings in person? Because I miss y'all's happy, smiling faces. And I'm sure that all of the people are now saying, the community who is not technologically savvy don't know about too much about Zooms and things like this. Where are we on that?
Yeah, so I think we're looking at a plan to add that in. But I'll tell you, if you look at what just happened in, may have been Chambly, I believe, they actually continued their public meetings and had a mini outbreak. I think someone who did not realize it had COVID-19, and some members of their population, especially their at-risk population, contracted the virus, as well as some staff members. So their operations as a whole are kind of, impacted now.
Yeah. Dr. Paxton, I know you're in your office, but how is the Zoom meetings and everything going for the health department?
Well, we're doing a lot of Zoom meetings, and in fact, that's the segue that I actually have to get off of this one, because I have yet another one that's scheduled for right now. So thank you for inviting me to this.
Thank you for being here, and Mr. Manager, you stay on because I got some more questions for you.
Okay.
But thank you so much, Dr. Paxton.
Bye.
Thank you.
Mr. Manager?
Yes, sir.
Okay, all right. Make sure you were still there. Let's go back to this. What we talked about a schedule for meetings, and we did that at our last conversation. Share with the public where we are with that.
Yeah, so I think the first thing we did is to make sure we can get greater public involvement and give folks more to digest, since we're now online now, is the council has kept the basic meeting schedule that we published at the beginning of the fiscal year, but has changed the format to where beginning in June, the first meeting will be solely a work session to go over all of the different items that will take place during the regularly scheduled meeting. And so that will allow the public to be able to hear about, understand, and be very involved in the process of items coming before the council. And then the second meeting is kind of a refresher on all of those things we talked about, and then implement the business of the city a little more quickly. And so that is only during the pandemic, but I think it is a really good model for us to not only involve our public, but have a great use of their time so that they can hear and know what's coming forward. And then when they have the opportunity to do public comment in the next meeting, they're able to kind of weigh in and give their insights, or remain silent and let the process go through, because they get all of the background information that sometimes they don't.
Well, I'm glad you explained that this is through the end of our fiscal year, through the pandemic period, because there was a lot of confusion as to whether this was going to be our regular meeting schedule. And so tell us a little bit about, we're not going to be doing that for now. We got to come back and decide what we're going to do after that.
Absolutely. So I think, people hear the term new normal, and I think they believe that everything has changed. And so that is definitely not the case. Currently, we are just forced to operate a certain way based on the unknowns around the pandemic. And so what we have done as a city is put things in place to keep the doors open and keep services going, but also temporarily be able to respond to the pandemic. All of the changes that the city has made has an end date, and that end date for the first end date is September 30th of 2020. That will allow all of us to ensure that we can operate during the pandemic, and at that time, whether there's a vaccine, whether there's new information, or whatever it is, the council will be able to evaluate and either make additional changes or make a return to normalcy.
Okay, I have just one or two more questions and we must leave. One is about our process for building permits, and I think to further that, our process is going to be for any permits, because as we go through this, we're learning a lot, and the new norm is probably going to be more technology than anything.
Yes, sir. And so I think there's a balance. And so we started off with the state of emergency. Pretty much everything shuts down, but revenues can't change. People, the longer that it takes somebody to build a home or an office building or whatever it is, the more it costs them. And so we don't want to pass cost on to our constituents. So we moved to an online model that allows people to be able to still manage their permits without having to come into the office. And so the next part of that is, not only have we done that, we'll be setting up online or teleconference meetings where our residents can actually call the permitting office and either call or online schedule individual meetings with a permit representative. And so they'll still get in-person service, but they'll be able to do so from the convenience of their home.
I just got another question from a constituent. What measures has the city put in place to prevent residents from playing basketball, tennis, etc. on outside courts?
Yeah, so I think the first thing we did is we kind of, and we can't control what happens in private communities because we don't have the oversight there. But for our communities, we have either removed or boarded up some of the basketballs, removed the actual tennis nets from the tennis courts, and made those areas inaccessible. I think in different communities, either the housing associations or the neighborhood committees or those individual homeowners actually have to make the decisions on whether they're going to allow those activities to take place because they're not technically illegal.
That's important because the meeting I had the other day with some homeowners is that there's certain things that's under their auspices or care. Shouldn't be confused with what we do as a city government. So that's very important. There's a question that says, can the city work with businesses to institute a citywide mass ordinance in buildings with a certain number of people?
Yeah, that's actually a part of the draft reopening plan. I think, again, people have civil liberties, right? And so while the CDC and the federal government have only recommended, it is really because you can't necessarily require certain things at certain levels of government. And so in our buildings, we can institute those types of things in private industry, and it's called private industry for a reason because it is really private. Their rules and regulations simply have to align with government rules and regulations, mainly at the state level. And so the governor's order makes it clear that cities can't add restrictions on top of his. And so we're working with all of the businesses in our community to not only create their own rules and regulations that align with ours, but we're also working with them to figure out how we may be able to jointly acquire some of these things to make masks cheaper for all of us so that we can supply them to the citizens versus passing that burden on.
Another question is, why are the parks closed? Why are the parks still closed?
I think for us, it has to do with both safety and capacity.
Right.
We're a city of 100,000 people, but we have a total staff of about 600, and that's fully budgeted staff. For us to kind of keep things moving in the way they are, our staff capacity now is actually at about 440 people. Of those, there are about 275 to 300 that are our essential staff members. It is very difficult, almost impossible, for us to both keep our community safe in their day-to-day operations, as well as operate and manage the parks and other activities to ensure social distancing 24 hours a day, 7 days a week. And so we have to balance the importance of do we want to make sure that folks aren't coming into your homes and kicking in your door and taking all of your valuables? Or do we want to make sure that we take people off community monitoring and putting them in the parks 24/7? And so our reopening plan will actually do both. We'll be able to ensure that we have increased monitoring of the parks while also increasing our community monitoring for normal everyday crime and ordinance enactment. So it takes a little time to do that. In the midst of a pandemic with limited resources, you've got to prioritize, and that's what we've done.
Well, this last question for you, and I know that you have a lot of involvement with police under your auspices as city manager. What is being done to eliminate carjackings, car thefts in the neighborhoods? Is this a priority? And if so, what is being done?
Yeah, it is. And, of course, I'll defer to the chief, but there's no way that we would not make those type of things an activity. Now, violent crime and things of that nature are way down. I mean, it's almost like 60% down as compared to this time last year. But what has happened is things like the slider crimes, the removal of Amazon packages off of folks' doorsteps and things like that have actually increased. And so what we are doing, I think we started, with the mayor's initiative to kind of help people understand what a slider crime is and how they can avoid those type of things. Same thing with Amazon and things of that nature when things are left on your doorstep or leaving valuables in your car. But there's also some things that we're doing to help educate neighborhoods so that they can, kind of do neighborhood watches and alert us and things of that nature, as well as placing police patrols at different neighborhoods more frequently. And so we can't give out all of the secret sauce, because if we do, criminals would know and they'd be able, to adjust and respond at the same time that we are. but it's definitely a priority. And I think, you know, it might be good to have the chief on here in the future to talk about different crime strategies and results that he's seen during this unique time.
And we can do that, but I want to add one thing to that, Mr. Donald, is that another rise in an area of crime is domestic violence.
It is.
And the pandemic has forced us to live closer to just each other, see everybody every day, and we're seeing a spike in domestic violence.
It's been fairly large, man. It's been interesting. What we've learned is that in any area of crime, most crime is actually done with people you know or have close contact with. And so the closer contact that you have, you're going to have more incidents. And so the more we shelter in place, you know, we've seen those numbers kind of spike, at least initially. We have seen those kind of go down as people get adjusted to the new normal, but it's actually been the largest spike in any crime that we've seen. The issue is that crime is both a prevention and response, but it is very difficult to prevent and monitor crimes of passion in a free society. Mm-hmm. You know, we don't have the authority and jurisdiction to place a police officer in each person's home and make sure that they behave appropriately. And so what we do is try to respond as quickly as possible. That's why our response times have been reduced quite a bit during the pandemic, and really try to mitigate these problems before they elevate from, you know, let's say a misdemeanor into a felony.
And we have to let people understand that crime, in the issue of fighting crime, is not something we do alone. We need the community support. You know, from time to time, we told people, you know, lock your cars, don't leave objects in your cars, computers, laptops in plain view. But it continues to go on. So it's very important to know that you must join hands with the police department to kind of put a nail in this coffin.
I 100% agree with that. It is definitely a preventative approach to mitigating crime is always helpful in communities, especially new communities like ours.
Okay, well, I want to thank you once again, Mr. Donald, for being my permanent co-host for a chat with the mayor, and also Dr. Paxton for coming in and loaning us as much time as she could to answer the questions that she had. Chat with the mayor is something we're going to do periodically because a lot of times citizens don't get a chance to communicate with the administrative arm of government. And I want to make sure that you get a chance to talk to the administrative arm of government, and we can talk about things that are more positive, where we're going, how we're going to get there. And so hence we started chat with the mayor. So thank you all so much for being here. Be safe and be South Fulton strong.